Hi, everyone. So we're going to do a recording of this presentation for the Equal Access Clinic. So my name's Katie. I'm the Administrative Director of EAC.
My name is Bree. I'm the Clinical Co-Director of EAC.
My name is Haley. I'm the Pro Bono Network Southeast Region Consortium Chair.
And my name is Christoph, and I am the OT liaison for the EAC here at UF.
Great. So this is going to just be a super quick orientation for all of the first years, just to kind of let you know who the Equal Access Clinic is and what PT's role is in it. So what is Equal Access Clinic? Equal Access Clinic Network is a series of student-run free primary care and specialty clinics at the University of Florida. So you can see this pretty extensive list of all the different things that is offered. It really started with these 4 primary care med clinics. And then after that, students from the ophthalmology department, people who specialize in women's health, LGBTQ health, peds, Spanish, you can see physical therapy there. Occupational therapy has their own Equal Access Clinic, as well as dental, psych, and then certain students that work with diabetes education and tobacco cessation.
Oh, right. So I am just going to break down basically what the PTEAC is. So we are treating every Thursday between 4 and 8 p.m. And this is during the school semester. So whenever we are off for breaks or holidays, we are not treating. This is, a school academic function. So we're not going to be treating when we're not in class. So it is student-led. However, we do have clinicians who are supervising the session. So that is basically just to guide the second years, guide their treatment to where, the second years are able to prescribe exercises and diagnose. However, the clinicians are still there in case, they do need assistance. So PTEAC is free. It's a pro bono clinic. The patients are not required to have insurance, so there's no copays or out-of-pocket fees. Any patient can come in and be seen and treated with direct access, so that does not require a referral from a physician, and they can be seen for 30 days. And then after 30 days, they are required to have a referral for further treatment. Originally, we were located at the CVS at the intersection of Southwest 16th and Southwest 13th. However, due to COVID, we are now treating via Zoom, which would be considered telehealth. Okay, so every semester you are scheduled one treatment session. You are required to attend this one treatment. However, you are encouraged to volunteer to observe as much as you want. The more, the better. You are going to learn more, and then you'll be able to see different diagnoses as well. And then at the end of the fall semester, we send out an application to where you are able to join the EAC Reach group. So let's say, you're in Children on the Go, you like to change the EAC. You're in Community Health, you would like to change the EAC. So with that, we kind of look for those who do volunteer more. That kind of gives you, more experience with it. We've seen that you're spending your time here more. You are demonstrating that you do want to be a part of this Reach group. So if you are chosen to be in this Reach group, you are required an additional 2 sessions of EAC each semester on top of your 1.
All right, so as first years, you guys have this lovely opportunity to volunteer for telehealth. But the first thing that you should know before we get into anything that you will be doing is that prior to you being in the visit at all, you should know that you should be checking for your email to make sure that you have any sort of confirmation email saying that you will be there this Thursday. And if you do, that email should have a Zoom meeting ID number, and it will give you explicit instructions on kind of things that you should know and things that you should look out for. And also a big important point that it will tell you is that you should be in that Zoom meeting at least 15 minutes before your scheduled time. And that just kind of gives you the ability to ask questions and things like that, get to know your clinician, the other PTs or the other students that are with you. So with that, the next part is kind of the different things that you'll be doing, the kind of things you'll be seeing. And so let's dive into that. Well, the first thing is when you get in, you're going to meet your patient, right? Let them know, your smiley face, don't be a robot. But at the same time, there will be a couple things that we might expect you to do. That being said, every clinician is different. They might ask you to do this. They might ask you not to. Maybe you'll just be spectating the whole time. Maybe you'll be a very active participant. That being said, the first step is usually the subjective and the objective. Okay, so that's usually when there's an interview kind of to get an idea of the patient's chief complaints, to get an idea of what's been going on, if they're getting better, if it's a follow-up, or if they're getting worse, and different things. So from that point, between that subjective and objective, so this is kind of how we break up this little pathway here. Between that subjective and objective, you will go to a breakout session with your clinician. So a lot of times this isn't necessarily followed, so you could very well just be in your breakout session with your patient all kind of together. But the technical way to do it is that everyone in your group, the student PTs, as well as you're also student PTs and yourselves, will go to a separate breakout room with your clinician. And so from there, you kind of go over like a sort of a strategy, right? The game plan is to figure out what's going on next, where the student PT should go in their objective, right? What tests should they do? What should they assess for? That kind of thing. So from there, and once they kind of get an idea with their clinician, then they're going to head back to the room with the patient, and then they're going to start performing the objective. So that's where they're going to do their analyses and things like that. And for the most part, considering that this is telehealth, yes, kind of limited in what you can do. However, you can, still look at their exercise form and certain things. So you'll be able to at least get a nice visual from your patients. And yeah. And so one thing I have down here is that you may be asked to help write the SOAP notes. The SOAP note, which you will learn, is kind of our standard way, really, of just figuring out or writing out all the information that's occurring. So your subjective, objective, your assessment, as well as the plan of care. And so all of those things will then get kind of put into those separate categories as you go. But you'll learn a little bit more about that. And as you get more comfortable, clinicians may say like, hey, would you like to do this? Like, yeah, sure. So always good practice. So then the assessment and the plan, that's just the SPT is going to be writing the physical therapy diagnosis, their prognosis, creating that plan of care. And then finally, the home exercise plan, which they might ask you to do. And we're going to get to that as to how you are able to kind of create that exercise plan that the student PT may ask of you. And then after that would be the end, right? So the patient would log off, you'd say goodbye. And then after that, you can talk with your clinician. You can get to know them a little better or ask them questions about your patient that you just had. They might also have another patient coming up as well. More than likely not, but sometimes they might. So you don't want to take up too much of their time, but just get to know them and ask any questions that you may have at the end. Make sure to send your SOAP notes to the student PT that you had at that point. One thing I forgot to mention about the breakout session is try not to ask questions at that point during the breakout session. The only reason that we ask is because sometimes, has kind of gone over a little bit and people would, really kind of keep answering the question and going before we know it, a lot of time has passed and the patient kind of gets, trying to figure out what's going on, if something big is going on or whatever. But yeah. So as we already found out, you will be assigned one time per semester. You can go to this Google Doc right here in pretty blue. And with that, you can sign up to volunteer. And we highly, highly recommend it. It's just, that's how you're going to get to know EAC a little bit better. You will get an email by Monday morning saying that, hey, you're coming this Thursday, right? If you cannot, please let us know as soon as possible and don't wait till the night of. And then, so another thing, of course, just look at the email that Brianne will send to you and you'll get an idea of, all right, so the date, time, all that stuff, get the link, and then just kind of like a couple other pointers just to know like what you could do as a first year. Yeah, just the basics, make sure you have a strong Wi-Fi connection, turn off other electronics or anything that might take up too much bandwidth. So that way you could have the smoothest connection possible. So in order to log on to Zoom, use your UF single sign-on, okay? So that's when you go into Zoom, that should be your login. Like actually use your username and password for that, and that should get you to be able to sign on with Zoom and to be able to use that for our purposes, right? And so from that point, yeah, just make sure you're copying and pasting the link that Brianne gives you in the Zoom window, and that if you're signed in, you should be good to go. And in terms of Practice Fusion, we will give you that information later. So if you're scheduled earlier, just don't freak out. Everything will be fine. We'll get it to you.
So Christoph already provided a really great overview of the process, but just to emphasize a few points, during treatment, you will be mostly observing the second year's treatment. However, once you have learned certain skills in class, you can assist if you feel comfortable. Please mute yourself and also make sure that you are in a distraction-free environment. No food or drink in the camera other than water. And as Christoph mentioned, please hold all questions until the very end. And so for the after treatment Q&A session, once the patient leaves the treatment session, this is when you will have an opportunity to ask any questions that you may have. Just a little pointer, use observation time during the session to Google terms, tests, and treatments that you may be unfamiliar with. And then your assigned clinician will recap treatment and provide feedback for both you and the second year treating. So home exercise program creation website. So pay really close attention to this info because it will be very important for you later on. So the website that we use is called HEP to go, HEP standing for Home Exercise Program. So basically what this is just a nice compendium of all different types of physical therapy exercises that you can do a quick search, and these exercises will pop up with a picture and a very clear, concise description of what that exercise entails. And then this is what you will be sending via email to the patient so that they have this throughout the week just to make it easier for them to follow their exercise program. So to log on to this site, the username is ufpteac@gmail.com, and then the password is muscle1!
Okay, so thanks you guys. I hope that wasn't too overwhelming, and I hope it was a good amount of information for you guys so that you are more prepared for your first assigned day of EAC. If you have any questions, here's the contact information for both Bree and I. Again, our inboxes are open, so just email us with any questions. We're more than happy to help. Here's a nice picture of our EAC Reach team. So if you are interested in joining, if you're interested in any leadership positions, just reach out to us and we can give you contact information to anyone on our board, you know, if you're looking to fill their position in the future. And we hope you have a great semester.